Some diseases kill you slowly. Others break you down so fast, you barely have time to understand what's happening. But the ones that are truly scary are the ones that feel wrong. The ones that hijack your brain, turn your body against itself, or trap you fully awake inside your own mind. And these are all real, documented, and in some cases, sadly, still untreatable. This is a deep dive into the 10 most disturbing diseases humans can get, explained in full detail. Subscribe to the channel for more content like this, follow my Instagram, join my Discord so we can hang out, and let's get straight into this shit. Fatal familial insomnia is a disease that kills you by taking away your ability to sleep. Not in a metaphorical, I'm stressed and can't rest way. Literally, your brain loses the function required to fall asleep completely. No sleep ever again. And when your body can't sleep, it falls apart fast. It's caused by a single mutation in a gene called PRNP. Prion protein gene. This gene normally helps create healthy proteins in the brain, but when it mutates, it starts producing misfolded prions. These prions are toxic. They build up in the brain and cause damage, especially in one place, the thalamus. That's the region that regulates your sleep cycles, your body temperature, your sense of time passing, and even your ability to process sensory input. Once the thalamus starts deteriorating, the symptoms hit hard. The disease usually appears in a person's 40s or 50s, but once it begins, there's no way to stop it. It progresses in 4 main stages, and every one of them is horrifying. Stage 1, progressive insomnia. You'll start having trouble sleeping, maybe a few hours a night at first, but it doesn't go away. It worsens until you're only getting 20 minutes at a time, or not at all. You become anxious, jittery, and emotionally unstable. Your body enters a constant panic state with rapid heartbeat, high blood pressure, and night sweats. But your brain is too damaged to rest. Sleeping pills don't work. Even general anesthesia has no effect. Stage 2, hallucinations and panic attacks. After a few weeks of severe sleep deprivation, your brain starts breaking. You lose the ability to distinguish between what's real and what isn't. Visual and auditory hallucinations become constant. Some patients think people are watching them or that they're trapped in a dream. You'll start having spontaneous panic attacks, sometimes while lying completely still. Your pupils will dilate. You might develop fixed facial expressions, locked in a look of suspense or terror. Stage 3. Complete insomnia and motor dysfunction. At this point, you physically cannot sleep. People become emaciated, stiff, and paranoid. Their speech slurs. Muscles twitch uncontrollably. Some lose the ability to swallow. Others start whispering nonsense or stop speaking altogether. The stress on your body is constant, like you're stuck in the worst part of a panic attack, 24/7 for months. Your immune system collapses. You become prone to infections and to fevers. You might be fully aware of your condition but unable to control any of it. Stage 4, dementia and death. The brain can't take any more damage. You forget who you are. You lose language. You stop responding to light or touch. Eventually, you slip into a coma. Not restful sleep, just full neurological failure. Your organs shut down. Death usually occurs within 7 to 18 months of symptom onset. What makes FFI so disturbing isn't just the symptoms, it's the fact that it runs in families. It's genetic. So if one of your parents had it, you have a 50% chance of inheriting the mutation. And it doesn't show up early. No signs in childhood, no warning headaches or memory loss. Just one day your sleep starts slipping away. The only way to know is through a genetic test, which some people in affected families choose to take. Others live with the uncertainty. There's no cure, no treatment. Prion diseases don't respond to antibiotics or antivirals because they're not caused by living organisms. They're just broken proteins that tell other proteins to break too. And the worst part is that FFI isn't even the only prion disease on this list, so stay tuned. Let's get that engagement up, guys. Let's get that viewer attention up. Stay engaged, keep watching, watch to the very end. Necrotising fasciitis is one of the most aggressive and painful infections the human body can experience. It's often called flesh-eating disease, and that's not just a scary nickname. It's what it actually does. It destroys your skin, your fat, your connective tissue. and sometimes even your muscle from the inside out. What starts as a small cut can turn into an amputation or death in a matter of hours. At its core, this disease is a rapid bacterial infection of the fascia, the connective tissue layers that lie just beneath your skin and wrap around your muscles, blood vessels, and nerves. Once bacteria can get into the space, they can move fast. Fascia has low blood flow, which means your immune system can't reach the area easily, and antibiotics struggle to penetrate it. It becomes the perfect breeding ground for catastrophic damage. The most common culprits are group A streptococcus, yeah, the same bacteria that causes strep throat, but other bacteria like Clostridium or Vibrio vulnificus, or even a mix of anaerobes can be involved. The infection usually enters through a break in the skin, something tiny like a cut, scrape, surgical incision, insect bite, or even a popped blister. You don't need to be in a swamp or sewage or anything dramatic. People can get it after a simple fall in the yard. The early symptoms feel deceptively mild: redness, swelling, soreness at the site. But very quickly, sometimes within hours, that pain becomes excruciating. Doctors describe it as pain out of proportion to appearance. That's the first major warning sign. You'll feel like your body is being burned or torn apart, even though the skin might just look bruised or slightly inflamed. Then it accelerates. The infected area starts to swell rapidly. Skin may blister. Underneath, tissue is dying, turning black, green, or purple as blood supply is cut off. You might hear crackling under the skin due to subcutaneous gas produced by the bacteria. My God, dude, holy shit, there's so many fucking words, bro. That's called crepitus, and it means gas gangrene is setting in. Meanwhile, the bacteria are releasing toxins that can cause systemic damage, dropping your blood pressure, shutting down organs, and throwing your body into septic shock. Fever, confusion, and loss of consciousness can happen fast. Survival depends on extreme medical intervention, immediate IV antibiotics, and emergency surgery to remove infected tissue. This often means cutting deep, wide sections of flesh off the body, sometimes entire limbs. Even then, it's not always enough. The mortality rate ranges from 20 to 40%, and higher if there's a delay in diagnosis or treatment. Death can occur in under 24 hours from first symptoms in the most severe cases. There's no vaccine, there's no immunity. It doesn't matter how healthy you are. There have been cases in children, athletes, people with no medical conditions. It's rare, but when it strikes without mercy. It's not something you can watch and wait with. The clock starts the moment the bacteria enter. In hospitals, if necrotizing fasciitis is even suspected, patients are rushed to the OR for exploratory surgery. That's how aggressive it is. Doctors will cut you open just to make sure that they aren't missing it. Negleria fowlerite is an amoeba, a single-celled organism that lives in warm fresh water. Lakes, rivers, hot springs, even poorly chlorinated pools. It's microscopic, easy to miss, and usually harmless until it finds a way inside your skull. Once it does, it becomes one of the most lethal organisms on Earth. In rare cases, usually during the summer, Negleria fowlerite enters the human body through the nose. This is the only known path of infection. It doesn't make you sick if you drink the water. But if contaminated water is forcefully pushed up your nasal cavity, like during diving, water sports, or using a neti pot with tap water, the amoeba can latch onto your olfactory nerve and begin crawling its way into the brain. This process can take only hours. Once inside, it triggers primary amoebic meningoencephalitis, or PAM or PAM, a brain infection that is almost universally fatal. The amoeba travels along the olfactory nerve fibers through the cribriform plate, a thin, porous section of skull at the roof of your nasal cavity. It's basically a direct tunnel from your sinuses to your brain. From there, Negleria begins consuming brain tissue. It doesn't passively infect you, it feeds. It literally eats your neurons, using structures called amoebostomes to rip apart and digest live cells. Symptoms start subtly, usually within 1 to 12 days after exposure. The early signs mimic bacterial meningitis: headache, fever, nausea, and a stiff neck. But then things escalate rapidly. You might experience confusion, seizures, loss of balance, sensitivity to light, and hallucinations. As the infection spreads, brain tissue swells aggressively. This leads to increased intracranial pressure, cutting off blood supply and crushing parts of the brain against the sides of the skull. Death usually occurs within 3 to 7 days after symptoms appear. By the time symptoms start, it's almost always too late. The infection moves incredibly fast, and the survival rate is less than 3%. Out of over 150 documented cases in the US since the 1960s, which, by the way, if there's only 150 cases in the US since the 1960s, you got nothing to worry about. But out of those, only a handful of people have survived. Those who did were treated with an experimental antifungal drug called methotrexate, along with induced hypothermia, cooling the body to reduce the swelling in the brain. But that's still not a guarantee. Most deaths happen even with aggressive treatment. Negleria fowlerite thrives in warm freshwater, especially during the summer when water temperatures are above 80 degrees Fahrenheit, or 27 Celsius. It's not found in saltwater. It can also live in soil or hot springs, and there have been cases tied to tap water used in neti pots or ritual cleansing. In 2011, 2 children died after using nasal irrigation with unsterilized tap water. The amoeba had survived in municipal plumbing. It's not contagious, you can't get it from another person, and it's rare, only a few cases per year in the US. But its death rate is so high that it's treated like a full medical emergency if even suspected. The CDC keeps the drug, the methotrexate, in strategic stockpiles to rush it to hospitals if needed. Harley Quinn ichthosis is one of the most visually shocking and physically brutal genetic disorders ever recorded. It affects the skin, but not in any superficial way. This disease alters how skin forms at the cellular level, turning it into something rigid, armor-like, and dangerously incompatible with life outside the womb. It's caused by mutations in the ABCA12 gene, which plays a critical role in transporting lipids to the outermost layer of the skin. Without functional ABCA12, the skin barrier doesn't form properly during fetal development. Instead of coming out soft and elastic, babies are born encased in thick, hard, plate-like scales of skin. These plates form geometric diamond-like shapes separated by deep bleeding cracks, hence the Harley Quinn name, a reference to the diamond pattern on old clown costumes. From the moment of birth, this condition is life-threatening. The skin is so tight, it physically warps the infant's face. Eyelids flip outward, lips are pulled back into a perpetual O shape, and ears may be misshapen or flattened. The fingers and toes can be constricted by the thick plates, sometimes cutting off blood flow and leading to auto-amputation, where the body's own tissue dies and falls off. The skin barrier is essential for survival. It keeps out infections, retains body fluid, and regulates temperature. In Harley Quinn ichthosis, none of that works. Newborns can't sweat, so they easily overheat. They lose moisture rapidly through the cracked skin, putting them at immediate risk of dehydration. Open fissures invite bacterial infections, which can become fatal in a matter of hours or days. Many infants born with this disease used to die within the first week of life. Treatment has come a long way. With modern neonatal care, including aggressive hydration, antibiotics, wound care, and the use of retinoids, which are drugs that help the skin shed properly, survival is possible. Retinoids help slow down the overproduction of keratin and make the skin less rigid, but the disorder doesn't go away. Children who survive continue to battle extreme dryness, painful cracking, high infection risk, and heat intolerance for life. Their skin has to be moisturized and exfoliated constantly, multiple times a day, every single day. Infections and hospitalization remain common. And that's just the physical reality. The social and emotional toll is massive. The visible nature of the disease often leads to stares, bullying, and isolation. Skin can appear red, flaky, or scaly even with treatment. Mobility may be limited because of skin tightness, and even basic functions like opening the mouth or bending fingers can cause pain and bleeding. Harley Quinn ichthosis is autosomal recessive, which means a child has to inherit 2 faulty copies of the ABCA12 gene, one from each parent, to develop it. The parents are usually carriers and completely unaware. There's no cure and no way to prevent it once the fetus has the mutation. Prenatal genetic testing can identify it, but many cases are only diagnosed at birth. Rabies is a viral infection that attacks the central nervous system, and once symptoms begin, it is almost always fatal. There is no recovery, no remission, no second chance. Death is inevitable, painful, drawn out, and horrifying. What makes rabies so disturbing isn't just its fatality rate, over 99.9 after symptoms onset. It's how it kills you, and what it turns you into along the way. Rabies is caused by the rabies virus, a member of the lyssavirus genus. It's transmitted primarily through the saliva of infected animals, usually via bites. Common carriers include dogs, in countries without widespread vaccination, bats, raccoons, foxes, and skunks. Once introduced into the body, the virus doesn't head straight to the bloodstream. It hides, traveling slowly along the peripheral nerves toward the brain, using the body's own neurons like a highway. This incubation period can last anywhere from a few weeks to several months, depending on how far the bite is from the brain. During this silent phase, there are no symptoms. A person might forget the bite ever happened, but once the virus reaches the spinal cord and brain, it multiplies rapidly and triggers acute encephalitis, which is brain inflammation. This is the point of no return. Once symptoms appear, survival is virtually impossible. Rabies presents in two clinical forms: furious rabies and paralytic rabies. Furious is the more dramatic and the more common. In furious rabies, early signs include fever, tingling at the bite site, irritability, and anxiety. But within days, the neurological symptoms explode. Patients experience hallucinations, violent agitation, and hyperactivity. Their pupils dilate, their body becomes hypersensitive to touch, light, sound. Anything can trigger a full panic response. One of the most disturbing hallmark symptoms is hydrophobia, an intense primal fear of water. The muscles in the throat spasm uncontrollably at the thought or sight of water, making it impossible to drink. Patients become terrified of choking or drowning, and often drool uncontrollably because they physically can't swallow. That's why you see so much foaming at the mouth. It's not a cliche, it's real. Eventually, the patient becomes delirious, lapsing into confusion and aggression. Some try to bite, others scream or lash out unpredictably. As brain function deteriorates, seizures may occur. The virus then begins to shut down respiratory and cardiac systems. Most patients die in a coma, usually within 2 to 10 days of the first symptoms. Paralytic rabies, the second form, progresses more quietly. Instead of dramatic agitation, the patient slowly loses motor function, staring at the site of the bite and moving inward. This can mimic Guillain-Barré syndrome or other neurological disorders. Death comes more slowly, often via respiratory failure, but it's just as irreversible. Once symptoms start, no treatment works. The only chance for survival is post-exposure prophylaxis, or PEP, a series of rabies vaccines and sometimes a dose of rabies immune globulin, given before symptoms begin. If PEP is administered quickly after exposure, ideally within a few days, it's nearly 100% effective. But if it's delayed or skipped, there's nothing medicine can do. Rabies still kills around 59,000 people per year, mostly in Africa and Asia, where access to vaccines and treatment is limited. Many of the victims are children. Dog bites are the most common cause. In the US, thanks to widespread pet vaccination, rabies deaths are rare, but bats remain a major risk. Several people in the past decade have died after minor bat bites or even exposure they didn't notice, like a bat flying in a room while they slept. There is one known case of a patient surviving symptomatic rabies. Gina Giese in 2004, who was put into a medically induced coma in what became known as the Milwaukee Protocol. But that method has not consistently worked since, and it's still not considered a reliable treatment. Creutzfeldt-Jakob disease, or CJD, feels like dementia on fast forward. It doesn't take years, it takes months, in some cases, weeks. One day you forget what you were saying mid-sentence, the next you're forgetting how to walk, how to swallow, or who your children are. It's not just memory loss, it's the total collapse of cognition, movement, personality, and language all at once, while your body jerks, spasms, and stares blankly ahead. What makes CJD so disturbing is how it hits without warning. The sporadic form, the most common, can happen to anyone. No genetics, no exposure. One day a single protein in your brain malfunctions and a chain reaction happens. The earliest signs might be brushed off. Clumsiness, a little confusion, maybe some depression. But very quickly, balance goes. Then speech. Then emotions. Some patients suddenly become cold and detached. Others go manic, laughing uncontrollably, shouting, or becoming aggressive. Hallucinations can set in. Whole personalities fragment. One of the clearest giveaways is myoclonus. Abrupt, violent muscle jerks that fire without warning. You could be sitting calmly and your body will lurch hard enough to throw objects or slam your limbs into furniture. In some cases, the eyes twitch rapidly or drift involuntarily. Reflexes become exaggerated. Doctors will test your foot and your whole leg might snap upward. The body starts misfiring in every direction. As the disease progresses, patients lose the ability to coordinate even basic functions. Walking becomes impossible. Speech becomes garbled or disappears altogether. Some patients can't swallow. They aspirate food and saliva, leading to pneumonia. Most end up bedbound, mute, and completely dependent before slipping into coma. The average time from first symptom to death is about 4 to 6 months. In rarer, aggressive cases, it's as fast as a few weeks. Diagnosis usually happens late because in the early stages of CJD, it kind of mimics other disorders. Stroke, encephalitis, rapidly progressing Alzheimer's, but nothing else degenerates this fast. Brain scans often show a ribboning pattern of degeneration across the cortex. EEGs detect bursts of electrical chaos, and spinal fluid may test positive for markers like 14-3-3 protein, a sign that neurons are dying in massive numbers. There is no treatment, no way to slow it down. Once it starts, the brain dissolves, functionally and structurally. It's not just that memories are lost or motor function declines. The brain physically softens and collapses. Autopsies show sponge-like holes throughout the cortex, visible even without magnification. By the end, most patients exist in a state of akinetic mutism, alive but motionless, unresponsive, and silent. Some appear to stare blankly at caregivers or track with their eyes but can't move or speak. It's not clear how much awareness remains, but the body is otherwise shutting down. Death usually comes through heart failure, respiratory failure, or secondary infection like sepsis or aspiration pneumonia. Morgullin's disease isn't terrifying because of what it does to the body. It's terrifying because we still don't fully understand whether what patients describe is even happening to the body at all. It's a condition where thousands of people across the world report the same thing. An overwhelming, persistent feeling that something is living under their skin, that tiny fibers are growing out of their wounds, that they're being attacked from the inside, and when they go to doctors for help, they're told it isn't real. The hallmark symptom is formication, the sensation of insects crawling just beneath the skin. But it's not just a feeling. Morgullin's patients often develop open lesions they say won't heal. They describe thin, thread-like fibers, white, black, red, or blue, emerging from the sores. Some pull them out and save them in plastic bags to show clinicians. Others dig into their own skin trying to extract them, sometimes using tweezers, pins, or knives. This behavior often leads to infection, scarring, and worsening of the wounds. The psychological distress is extreme. Here's where it gets complicated. Most mainstream medical studies, including a large CDC-backed investigation in 2012, found no evidence that the fibers were biological. In that study, fibers collected from the 115 patients were analyzed and found to be mostly cotton, plastic, or environmental contamination. Not parasites, not fungus, not secretions. Skin biopsies showed no infectious agent, and instead, the patients showed signs of chronic scratching, dermatitis, and sometimes underlying psychiatric conditions, like delusional parasitosis. But some researchers and patient advocates argue that the case isn't closed. A few studies, mostly outside of mainstream journals, suggest that the fibers may have a biological origin, keratin or collagen, possibly produced by the body itself in response to an unknown trigger. Some speculate about Lyme disease co-infection, fungal involvement, or even environmental toxins. So far, none of these theories have been widely accepted. This is what makes Morgllin so disturbing. It sits right on the edge between dermatology and psychiatry. The people suffering from it often doesn't look like they're self-harming or inventing symptoms, but the pain they describe is real. Many lose the ability to work, to sleep, to go out in public. Relationships collapse. Some become reclusive, others become obsessive, logging symptoms, collecting samples, and rejecting any diagnosis that frames it as psychological. The risk of them taking their own life is also significantly elevated. Also, thanks to this comment right here, I think there's two of them, but one that I responded to, where I didn't even think about this, but in my videos I used to say unalive whenever I was referring to, taking one's own life, and I didn't even think about how that could be seen as not a very good way to put it. It could be seen as like, offensive or making light of it. That didn't even cross my mind at all, and I'm so sorry if you took it that way, or if you have anyone in your life that's suffered from that and done that. It's awful and it's terrible, and I'm so sorry, I didn't mean to make light of it at all. There's no standard treatment. Patients who are convinced they have parasites often reject psychiatric care. Antipsychotics and antidepressants can reduce symptoms in some cases, but only if the patient accepts the diagnosis. Antibiotics, antifungals, and antiparasitics are commonly prescribed by alternative medicine doctors, or Lyme-literate practitioners, but controlled studies don't show consistent improvement. The medical community remains divided. Most dermatologists and psychiatrists treat Morgllins as a manifestation of a delusional disorder, a somatic psychosis where the body falsely interprets normal skin sensations as foreign invasion. But for patients, that feels like being gaslit by the very people that they're turning to for help. Fibroisplasia ossificans progressiva, or FOP, is one of the rarest and most physically imprisoning conditions ever documented. It turns soft tissue, muscles, ligaments, tendons into bone. Not figuratively, actual bone inside your body where it shouldn't be. And once that bone forms, it can't be removed because any attempt to cut it out only triggers more bone growth. Over time, your body becomes a living statue, fully conscious but encased in your own skeleton. It's caused by a mutation in the ACVR1 gene, which plays a key role in regulating the bone morphogenetic protein signaling pathway. In healthy people, BMP, or the bone morphogenetic protein, helps bones form during embryonic development and healing. But in FOP, the mutated gene tells the body to activate this pathway in soft tissue, triggering bone formation. Most people with FOP are born appearing completely normal except for one telltale sign: malformed big toes, often short and angled inward. It's usually the first clue, but the disease itself doesn't kick in until early childhood. The first flare-ups feel like swelling or bruises. Parents might think it's a sports injury or a bug bite, but the swelling doesn't go away, and then it hardens. That's new bone. The ossification often begins in the neck and shoulders. Ossification is bone formation, slowly spreading down the back, chest, limbs, and eventually the jaw. Joints freeze. Movement becomes restricted, then impossible. Even small injuries like falling, getting a vaccine injection, or biting the inside of your cheek can trigger new ossification. Surgery is out of the question. If doctors try to remove the bone, it grows back faster and more aggressively. Some patients grow a second skeleton, bone over bone, entirely through soft tissue. It can wrap around muscles, organs, or even create false joints in places that were never supposed to move. One of the most devastating complications is chest wall ossification. When the muscles between the ribs turn to bone, it becomes harder to breathe. Lungs can't expand. Pneumonia becomes common. Many patients die in their 30s or 40s from respiratory failure, infections, or complications from being fully immobilized. There's no cure. Treatments like steroids may reduce inflammation during flare-ups, but they can't stop the bone from forming. Gene therapy and BMP inhibitors are being researched, but nothing yet stops the underlying mutation. Diagnosis is clinical and genetic. Imaging shows clear sheets of bone and tissue, and the gene mutation is identifiable with a simple test. FOP is ultra rare, affecting about 1 in 2 million people worldwide. It's autosomal dominant, meaning only one copy of the mutation is needed, but most cases are caused by a random mutation, not inherited. There's no way to prevent it, and since it's so rare, most cases are misdiagnosed at first. Some children with early symptoms have had biopsies or surgeries that massively worsened their condition before anyone realized what they had. Kuru is a deadly neurodegenerative disease that was once endemic to the 4 people of the eastern highlands of Papua New Guinea. For decades, people, mostly women and children, were dying in increasing numbers from a mysterious illness. It caused trembling, muscle loss, emotional breakdowns, and uncontrollable bursts of laughter. The locals called it Kuru, meaning to shake or trembling with fear. Outsiders started calling it the laughing death. What was actually happening was a textbook prion outbreak, though no one knew it at the time. The four had a deeply spiritual practice of ritual endocannibalism. After a loved one died, family members, especially women, would cook and eat the deceased body as an act of mourning, love, and spiritual continuity. The brain was considered sacred, and women often took the role of consuming it. Unbeknownst to them, they were ingesting massive amounts of infectious prions from the brain tissues of victims who had already died of Kuru. Every bite passes that disease on. Once inside the body, the prions quietly traveled through the lymphatic system and into the brain, sometimes taking years or even decades to incubate. That's what made it so hard to track. People could eat contaminated brain matter as children and not show symptoms until their 30s, but when it hit, it always followed a brutal progression. The first stage is ambulatory. Unsteady gait, muscle tremors, difficulty coordinating movement. Victims started tripping over themselves. Hands tremble constantly. They have trouble speaking or standing without help, but they're aware. They know something's wrong. Next is a sedentary stage. At this point, they can no longer stand. Tremors become worse. Muscle wasting begins. People lose the ability to feed themselves. Their emotional regulation breaks down. Many laugh uncontrollably or cry for hours. It's not joy or sadness. It's a sign that the frontal cortex and cerebellum are being eaten alive. Their personality warps. Some hallucinate or become childlike. Others are catatonic. Finally comes the terminal stage. Complete inability to move, speak, or swallow. They slip into a comatose state and die, often of starvation, infection, or pneumonia. The disease has a 100% fatality, and death usually occurs within 12 months of the first symptoms. When the four were informed of the link between Kuru and consuming the dead, they voluntarily abandoned the practice. It was a massive cultural sacrifice, one tied to love, memory, and spirituality. But they made it, and the disease began to vanish. However, because of the long incubation period, isolated cases continued to appear for decades. The last known confirmed case of Kuru was in 2009. Locked-in syndrome is exactly what it sounds like. Total bodily paralysis while the mind remains fully conscious and aware. You're awake, you can think, you can feel, but you can't move. You can't speak, you can't scream. You can't even blink unless the right muscles are spared. The only sign that anything's still functioning is eye movement. Usually vertical only. Everything else is gone, and that's how doctors know you're still in there. The condition usually results from damage to the ventral pons, the part of the brainstem responsible for relaying signals between the brain and spinal cord. This can happen suddenly, usually through stroke, traumatic brain injury, brainstem tumors, or even advanced stages of certain diseases like ALS. The injury cuts off motor control but leaves cognition, emotion, sensation, and awareness completely untouched. It doesn't destroy memory, it doesn't alter who you are, it just removes the bridge between thought and action. The first moments are pure horror. Many patients are initially believed to be in a coma or vegetative state. Some are even misdiagnosed for days or weeks, but they're watching and listening the whole time. They hear the voices in their room, they feel the sheets, they may even feel pain or itching, but they can't react. They can't communicate they're alive unless someone thinks to test for eye movement or brain activity. If vertical eye movement is preserved, that becomes their lifeline. They can learn to blink once for yes, twice for no. Some patients eventually use spelling boards or eye-tracking computers to write messages, letters, even books. But communication is agonizingly slow. One letter at a time, blink by blink. It can take hours to say a few sentences. Emotionally, the experience is devastating. The awareness of being fully alive and trapped in silence creates high rates of depression, anxiety, and emotional lability. Crying or laughing involuntarily. Some patients report terrifying vivid dreams, intrusive thoughts, or being overwhelmed with panic while being unable to control their breathing or facial expression. Others describe it as a form of psychological torture, the sensation of being buried alive inside your own skull. There's no cure, but not all locked-in patients remain static. Some regain partial movement after months or years of therapy. There are documented cases of people learning to speak again, walk again, but these are the exception, not the rule. Most patients remain dependent on others for everything: feeding, bathing, breathing, communication, and even then their intellect and memory remain untouched. The most well-known case is Jean-Dominique Bobby, a French journalist who suffered a stroke at age 43 and dictated an entire memoir, The Diving Bell and the Butterfly, one blink at a time using only his left eye. Another case is Martin Pistorius, who was believed to be in a vegetative state for over a decade before someone realized he was mentally present the whole time. Thank you for watching, guys. This was the Diseases Explained video. I hope you enjoyed it. If you're still here, be sure to subscribe for more videos, leave a like, leave a comment. But most importantly, good night, everyone. Sweet dreams.